there are state-specific rules on who can own a medical practice or a med spa. And in states that have CPOM corporate doctrine, the professional entity structure needs to be developed. So you need to have a professional corporation or professional limited liability corporation in place. This is applicable to about half the states in our country. As an example, some of the big states that this pertains to is Texas, California, and New York. And again, in these instances, the physician must own the professional corporation. However, just because a physician owns the professional entity doesn't mean that a med spa or a business that wants to be in the med spa space cannot operate. So the way that you make that happen is with something called an MSO-MSA structure. Essentially, the med spa operator becomes a management company or manager of the professional practice, and the manager is known as the Management Services Organization, and the MSA is the Management Services Agreement, and that is the contract that is formed between the manager and the professional corporation. Services in this setup must be billed through the professional corporation, meaning if you're collecting money on behalf of patients for medical services or med spa services or aesthetic services that are being overseen by a physician, that money must flow through the professional corporation. The management services company will then bill fees or administrative fees for what it does or administrative/management fees from the professional corporation, and that's how it's able to collect money out of the PC. Now, I always like to talk about a couple of different compliance considerations and what I think is the best rule of thumb for somebody in a state that has CPOM doctrine. Number one is that licensed professionals who are providing medical services, for example, the medical director or a physician if they're on site, a nurse practitioner, or PA, or an RN, anybody that's involved in touching a patient or overseeing the care of a patient should be contracted or employed by the professional entity, meaning they get their paycheck from the professional corporation. The other thing that I think is important to discuss or mention is that it's best to avoid something called umbrella PCs. There are undoubtedly several services or independent physicians out there who want to work with as many aesthetics practices as possible. So what they do is they create a professional corporation in a particular state and then have all of their clients or med spas or management companies work under the same PC. While in practice, in the short run, that may be more financially beneficial and maybe more affordable because there's less fees or the fees can be split among different management companies. There's also one significant risk of setting it up under one PC. And that is if one med spa gets in trouble, let's say they're non-compliant and they get shut down by the state may also go ahead and shut down the entire PC. And if the PC is shut down, you are no longer able to practice. And so there may be one bad character can spoil the entire PC. And so my rule of thumb is to always have a one PC to one MSO structure.